Hello everyone. We previously studied the diagnosis and treatment of cold and headache. TCM is a practical medical system. Therefore, the Chinese medical doctors mainly focus on how to deal with the various diseases by using different therapeutic methods. Today, we are going to go through the whole contents about stomachache. Stomachache, also called epigastric pain, refers to the disease with the main symptoms of frequent pain in epigastrium, which is generally caused by external pathogenic factors invading stomach, bad mood, improper diet, overstrain, and the weakness of spleen and stomach. About pathogenesis, firstly, external cold pathogen invading stomach, cold causing contraction, and then qi and blood stagnating and coagulating, and that results in stomachache. Secondly, various reasons can impair the functions of spleen and stomach. Dysfunction of spleen and stomach may result in a low digestive ability, which may cause stomach pain. Thirdly, anxiety, thought, anger, and depression all can induce liver qi attacking the stomach, leads to stomach qi failing to descend, which causes retention of stomach qi, then leads to pain. Differentiation of stomachache must differentiate deficiency and excess, cold and heat. Excess syndrome usually takes on sore pain and fixed pain, refusing pressure, and replete with pulse. While deficiency syndrome is mild pain and migratory pain relieved by pressure and feeble pulse. According to the pathogenic factors, the most common syndromes of stomachache include cold stagnation syndrome, deficiency cold of spleen and stomach syndrome, and liver qi invading stomach syndrome. In clinic, flexibly select different therapies depending on different syndromes. The basic pathogenesis of stomachache involves disorders in digestion, transportation, and ascending-descending function of spleen and stomach. For the cold stagnation syndrome, it is mainly caused by external cold pathogen invading stomach. With the cold invading, the qi movement is obstructed and stagnated, which causes sudden and violent stomachache. And the result, pain will be reduced in case of getting warm, while increased in case of cold, and patients are preference for hot drink. The clinical manifestations of cold stagnation patient commonly have the following features: sudden and violent stomachache, aversion to cold, relieved by warmth, preference for hot water, thin white tongue coating, and very tight pulse. The therapeutic principle should be warming stomach and dissipating cold, regulating qi, and relieving pain by using Chinese herbs or acupuncture. Liangfu pill is suggested for the cold stagnation syndrome patients. For the patients with serious cold, it may add wuzhuyu and ganjiang, etc. For the patients with serious qi stagnation, it may add muxiang, chenpi, xiangfu, and wuyao, etc. Acupuncture is an effective therapeutic method. For treat the cold stagnation, acupoints, Governor Meridian 12 and Precardium Meridian 6 are selected to be stimulated using needles. There is a very convenient way to relieve the stomach pain, pressing the point which is shown in the picture. Patients can do this by themselves in both arms. Now let's move to the second syndrome, deficiency coat of spleen and stomach. This is caused by iron deficiency, affecting the spleen and the stomach, leading to the retention of fluids. Stomachache with deficiency coat of spleen and stomach usually has the following clinical manifestations: developing of epigastrium, preference for warmth and pressure, loose stool, pale tongue, and feeble or weak pulse. Warming yang of spleen and stomach is a basic therapeutic principle. According to this principle, warm-natured herbs will be considered to compose the formula. 黄芪建中 decoction is a typical formula for treating the deficiency coat of spleen and stomach. The formula is composed with 6 herbs, which main functions are warming the spleen and stomach, removing the coat from the spleen and stomach, as well as tonifying the digestive function of spleen. For patients with stomach pain, much more resulting from stomach coat, it may add 凉附 pill. For patients vomiting clear water, it may add 陈皮, 半夏, and 茯苓, etc. Because of the cold resulting from the iron deficiency, therefore warm is preferred by the patients. As we talked about previously, moxibustion is a good way to warm organs and expel cold. So moxibustion can be used to treat the deficiency coat of spleen and stomach syndrome. The acupoints bladder meridian 20, bladder meridian 21, and the stomach meridian 36 are the best choice for doing the moxibustion. For the third type of syndrome, liver qi attacks the stomach, leads to stomach qi fail to descend, which causes belching and acid regurgitating. Qi stagnation leads to disorder in transportation of intestinal canal, and as a result, inhibited defecation. The clinical manifestations of liver qi invading stomach syndrome mainly are as follows: distending pain of epigastrium, pain onset as long as emotional upset, belching frequently, inhibited defecation, thin white tongue coating, and a wiry pulse. Soothing liver and regulating qi, harmonizing stomach, and relieve pain are the therapeutic principles for treating liver qi invading stomach syndrome. 柴胡疏肝 powder is the first suggestion for this syndrome. The main function of this formula includes soothing the liver and harmonizing the stomach. For patients with serious pain, it may add 川链子, 咽喉锁, and 佛手, etc. For patients with belching and acid regurgitating, it may add 瓦楞子, 海飘消, and 沉香, etc. For patients with distending feeling of extreme pains, it may add 木香 and 厚朴, etc. We just went through the diagnosis and treatment of stomachache. Here is the healthcare tip. Ginger and brown sugar can warm the stomach. Take decocted ginger water infused with brown sugar. This is really helpful for the patients with mild cold syndrome. Okay, that's all for today. I'll see you in next class.